Today we received more unsettling news about our economy. Jobless claims are now the highest they've been in 26 years, with more than 570,000 people filing for unemployment benefits for the very first time. And this news comes at a moment when our auto industry is struggling, threatening the jobs, health care, and pensions of not just thousands of American auto workers, but dealers, suppliers, and others all across America. Now, I understand people's anger and frustration at the situation our auto companies find themselves in today. I raised concerns about the health of our auto industry a year and a half ago when I spoke to industry leaders in Detroit. I urged them to act quickly to adopt new technologies and a new business approach that would help them stay competitive in these changing times. And while they failed to move quickly enough towards these goals, at this moment of great challenge for our economy, we cannot simply stand by and watch this industry collapse. Doing so would lead to a devastating ripple effect throughout our economy. As I have said repeatedly, I believe our government should provide short-term assistance to the auto industry to avoid a collapse while holding the companies accountable and protecting taxpayer interests. The legislation in Congress right now is an important step in that direction, and I'm hopeful that a final agreement can be reached this week. Now, I'm also aware of your interest in the matter of the Illinois Senate appointment. Let me say that I was as appalled and disappointed as anybody by the revelations earlier this week. I have never spoken to the governor on this subject. I am confident that no representatives of mine would have any part of any deals related to this seat. I think the materials released by the U.S. Attorney reflect that fact. I've asked my team to gather the facts of any contacts with the governor's office about this vacancy so that we can share them with you over the next few days. Finally, on this matter, let me say that this Senate seat does not belong to any politician to trade. It belongs to the people of Illinois, and they deserve the best possible representation. They also deserve to know that any vacancy will be filled in an appropriate way so that whoever is sent to Washington is going to be fighting for the people of Illinois. I hope and expect that the leaders of the legislature will take these steps to ensure that this is so. I'd now like to turn to the topic of today's press conference. Over the past few weeks, Vice President Biden and I have announced key members of our economic team who are working as we speak to craft a recovery program that will save and create millions of jobs and grow our struggling economy. Today, I'm pleased to announce two leading members of my healthcare team whose work will be critical to those efforts: Senator Tom Daschle and Dr. Jean Lambrew. I've asked Tom to serve not just as my Secretary of Health and Human Services, but also as my Director of my White House Office of Health Reform. As such, he will be responsible not just for implementing our health care plan, he will also be the lead architect of that plan. Jean will serve as Deputy Director of this office, working closely with Tom on these efforts. It's hard to overstate the urgency of this work. Over the past 8 years, premiums have nearly doubled, and more families are facing more medical debt than ever before. 45 million fellow citizens have no health insurance at all. And day after day, we witness the disgrace of parents unable to take a sick child to the doctor, seniors unable to afford their medicines, people who wind up in emergency rooms because they have nowhere else to turn. Year after year, our leaders offer up detailed health care plans with great fanfare and promise, only to see them fail, derailed by Washington politics and influence peddling. This simply cannot continue. The runaway cost of health care is punishing families and businesses across our country. We're on an unsustainable course, and it has to change. The time has come this year, in this new administration, to modernize our health care system for the 21st century, to reduce costs for families and businesses, and to finally provide affordable, accessible health care for every single American. Now, some may ask how, at this moment of economic challenge, we can afford to invest in reforming our health care system. And I ask a different question. I ask, how can we afford not to? Right now, small businesses across America are laying off or shutting their doors for good because of rising health care costs. Some of the largest corporations in America, including major American car makers, are struggling to compete with foreign companies unburdened by these costs. Instead of investing in research and development, instead of expanding and creating new jobs, our companies are pouring more and more money into a healthcare system that is failing too many families. So let's be clear. If we want to overcome our economic challenges, we must also finally address our healthcare challenge. I can think of no one better suited to lead this effort than the man standing beside me today. Tom Daschle is one of America's foremost healthcare experts. He and Jean have written a groundbreaking book on the subject, filled with fresh ideas and creative solutions. And Tom's thinking on this issue is informed not just by statistics he's studied or policy papers he's read, but by his years representing the people of South Dakota, witnessing firsthand their struggles as hospitals closed, doctors were few and far between, and care was often out of reach. But Tom brings more than just great expertise to this task. He brings the respect that he earned during his years of leadership in Congress. He knows how to reach across the aisle and bridge bipartisan divides. And he has the trust of folks from every angle of this issue: doctors, nurses, and patients, unions and businesses, hospitals and advocacy groups, all of whom will have a seat at the table as we craft our plan. And once we pass this legislation, I know I can rely on Tom to implement it effectively. A gifted manager, Tom is the original no-drama guy, known for speaking softly but leading boldly, always treating his staff with respect while demanding excellence and empowering them to deliver. And I know Tom will bring that same decency, graciousness, and pragmatism to this new role. Tom could not have a better partner in this work than Jean Lambert. Jean brings a depth and range of experience on health care that few can match. She's a leading thinker on this issue, nationally recognized for her research on Medicare, Medicaid, long-term care, and the uninsured. She's a policy and budget expert, having served at a senior level at both the Office of Management and Budget and the National Economic Council. She helped lead the effort in the White House to create the Children's Health Insurance Program, and she helped craft the President's Medicare Reform Plan and Long-Term Care Initiative. And like Tom, Jean has a personality perfectly suited to reaching out and building consensus. She listens. She treats people well. She, like Tom, believes, as Tom put it in his farewell address to the Senate, that the politics of common ground will not be found on the far right or the far left. That's not where most Americans live. We will only find it in the firm middle ground of common sense and shared values. I could not agree more, and I look forward to working with Tom and Jean in the months and years ahead. With that, let me ask Tom to step forward and say a few words.
Thank you very much, Mr. President-elect. It is a great honor to be nominated to work on an issue that is so close to my heart, leading an organization that touches so many lives at a time that there is so much at stake. There is no question that fixing health care is and has been for many years our largest domestic policy challenge. We have the most expensive health care system in the world, but are not the healthiest nation in the world. Our growing costs are unsustainable, and the plight of the uninsured is unconscionable. Addressing our health care challenges will not only mean healthier and longer lives for millions, it will also make American companies more competitive, address the cause of half of all of our personal bankruptcies and foreclosures, and help pull our economy out of its current tailspin. That is why it is so exciting for me to take this dual role that you have outlined today, not just implementing reform, but helping to generate it. Whether it's administering Medicare and Medicaid, keeping our food and pharmaceuticals safe, researching the cures of tomorrow, or investing in prevention and wellness, a well-functioning Department of Health and Human Services can play a strong role in tackling the many health care challenges our country faces. And as Director of the White House Office of Health Reform, I'm eager to work closely with the people from across the country to find a path forward that makes health care in this country as affordable and available as it is innovative. As you did so effectively in your campaign, Mr. President-elect, we're also going to bring the American people into this conversation and make health care reform an open and inclusive process that goes from the grassroots up. Over the next few weeks, we will be coordinating thousands of health care discussions in homes all across the country through our website, Change.gov, where ordinary Americans can share their ideas about what's broken and how to fix it. I'll be attending some of these discussions, seeing the ideas generated by others, and looking forward to reporting back to you on what we find. One of the first conversations I had with then Senate candidate Obama was about the need for meaningful national health care reform. Today, I'm grateful to President-elect Obama for giving me the chance to make that a reality. I'm honored by your trust, and I look forward to the opportunity to serve our nation once again. Thank you.